I basically don't have time to talk about everything I've done, but I basically have like a 20-year history of trans activism in Philadelphia, including founding a few organizations, including this conference.
All right, and we want to make sure, of course, we thank people who have participated or were members of the Trans Aging Advisory Committee who put together the report we're here to discuss. And I see at least one or a few people in the audience. If you want to acknowledge yourselves.
Yay.
So maybe to kick it off, I'll throw it over to Harper Jean to make a few comments.
Sure. So very quickly, we attempted in this survey, there have been folks who've been out there doing trailblazing work in transgender aging, places around the country for quite some time, including obviously in the Philadelphia area, but we wanted to kind of see if we could do something that kind of elevate the discussion of transgender aging issues in the broader trans community, in the aging field, as well as sort of highlight it within the emerging field of LGBT aging. So to do that, we sort of try to survey what we know from research, from anecdotal knowledge of practitioners, advocates, community members, about the challenges facing trans older adults, and to provide an introduction to the topic for practitioners in the aging field and policymakers, as well as some concrete recommendations for practice and policy. To do that, we brought together a diverse group of trans, aging, and LGBT advocates from around the country to identify promising strategies to improve the lives of transgender older adults. We surveyed the existing literature. We looked at the challenges that we know face trans people across the lifespan, challenges of stigma, often rejection, economic discrimination, disproportionate poverty, victimization, barriers to healthcare, barriers to updating ID and official records, and others. We looked at how those issues might in particular impact trans older adults in light of the issues that people face generally as they age, as well as the light of the fact that the trans folks who are older today, came of age in times when being trans is even more universally stigmatized and pathologized, and many of them, although certainly by no means all, hid their identities for decades. And we looked at this also within the context of the broader challenges of supporting older adults generally, from developing funding structures and an adequate workforce to provide competent care for people as they age, to detecting and stopping elder abuse, to providing adequate affordable housing and expanding the stock of affordable housing for older adults. And all of those issues that sort of the aging field, as it were, is the Aging Services Network is trying to sort of gear up to address, to look at how being trans and the needs of trans folks fit into that. So the report that we came up with was it's by no means exhaustive, but it's certainly probably a lot to add to it. But in 50 pages, we tried to give an overview of some of the important issues for practitioners and policymakers to know about. Our wide-ranging recommendations include aspects of the broader aging and trans advocacy and LGBT aging agendas, as well as some things that are specific somewhat to trans older adults. And we hope that the result can serve as a sort of roadmap for integrating the needs of older trans folks into all of these broader agendas, and kind of bring together the work that's going on in trans communities and in the aging field, and the work that so many folks scattered across the country are really trying to do to raise the profile of it and better address these issues. So we hope that it can be a tool to move that conversation forward.
Great. I'll go next if that's all right. Okay, so when I joined the working group for the aging track here at the conference about 2 years ago, really 3 out of about 200 workshops were geared towards the aging population. Since that time, it's increased at least 4 times. So we have about 12 workshops geared towards the aging population today at the conference, which I'm extremely proud of. I think that's for a few reasons. It's the hard work of the dedicated volunteers who helped to create the conference. I think it's also the growing visibility and advocacy for and with trans elders, so that's something that I'm incredibly excited for and about. But I also think, a lot of it has to do with the work of organizations such as SAGE and the National Center for Trans Equality, and for reports like this that really inform that conversation, and their continued dedication to be present and visible at this conference and presenting workshops. So I'm entirely grateful for the work that y'all have done and the work that our elders do to create this visibility and this energy at the conference. It's something that I'm excited to see grow. We have over 2,000 participants just this year, which is even increased over last year. And by the end of the conference, we expect that there will be about 3,000 registrants this year, which is phenomenal. So definitely the conference grows every year. And I know that the conference is committed to having elder visibility and really creating workshops that are relevant for folks from age 9 to 90. So I'm very excited to continue to help grow the aging visibility at the conference. So thank you for being here.
Okay. Well, I unfortunately don't have any as well-structured comments, but since I was asked to speak about local issues and initiatives, I started scrambling to do so. You probably have a better perspective in terms of the elders that are actually active and involved. I'm about to turn 50, so I'm starting to really get concerned about these issues, considering I haven't even gotten a job yet. So screw retirement, whatever that is. I'll be working till the day I drop, the government until the day I'm done, and probably, get stuck with some of that. So one of the things I did was just call a few key people that I know and ask, what's going on. And it seems to be that I first want to say, to Philadelphia's credit, that we're taking the initiative in terms of some very important, some very unprecedented activities. One being the Magnus Hirschfeld Fund that's funding and it's organizing senior residences. Chris can correct me on this, but I'm assuming it's mostly for LGBTQ elders. But we talked about the complexities of being able to place LGBT elders in the building. But that's the intention behind the residences. So that's moving ahead. At this point, as well, the LGBT Elder Initiative, which is designed more as a resource to collect resources, to gather information, to perhaps start educating providers. I think it's in its formative stages. So in the past 2 years, there have been initiatives like this happening in Philadelphia. Plus, you didn't really mention it, but substantively, there are elder groups at our community center here. So Chris told me there was a group, it seemed to be divided, a women's group, a men's group, and a mixed group. So we have things going on, and that's to the positive. I will say very bluntly that I believe that these initiatives largely serve LG and B people. And there's reasons for that are historical, that go way back. In some ways, I feel like I've stepped back 20 years. 20 years ago, when I started being an activist in this city, a lot of times I was the only person in the room. And it just is amazing to me to see now that there are a lot of younger people, there's a lot of people with a lot more energy than me that are stepping up, that are just filling spaces, that are acting collectively, that get together, that talk to each other, that create political strategies and that are part of a movement building that's much larger than individual activism even. So one of the things that I'm struggling with is how are trans and gender nonconforming people going to be included in these initiatives that have already begun when we're not there in great numbers, either in membership or in leadership positions, to help set the agenda from the ground floor. So if we're not there when the agenda is being set, I guarantee you it's going to be set, not purposely, but unconsciously, without our needs in mind. And that's going to set a structure that's going to be much harder to change. If you think about this from a legislative perspective, a lot of times they say, you know, when a law gets put in place or an amendment or something to a law, you know, it takes about 40 years to like undo it. So you've got to be very careful like what you do because undoing it is a lot harder than doing it in the first place in some cases. So I'd like to see more, and this is a challenge to the people sitting in the room, more effort made to bring trans member and leadership in on the ground floor, okay? And from the beginning, be informing the policies and practices that is going to help structure these initiatives, and it's going to allow us to best meet the needs, particularly of trans and gender nonconforming elders. And, you know, I don't want to rank oppressions and hierarchize, and it's very problematic when we do that because everybody's situation is different. I will say that trans folks, by and large, I mean, I'll just give you an example and then I'll end. You know, I've heard recently an example that, you know, particularly when we lose control of our bodies in terms of like being in institutional spaces, I would call them carceral spaces, whether that's prisons, hospitals, and nursing homes, okay? They all have operate according to the same logic. You lose inherent rights to control over your body in these spaces, okay? And with gay, lesbian, and bi people who are not also trans, and this is another issue I'm just going to end with in a second. We have a situation where it's not a choice to remain in the closet, okay? That's, to me, relative to more like how we negotiate our sexuality. And we may need to be in the closet around our sexuality, depending. But we cannot put in the closet our gender nonconforming bodies. Our very bodies are going to out us every time. And as we lose control, meaning that autonomy that we have over our bodies, as we age, and as we have to include other people in our care, this is going to affect us in ways that I think gay, lesbian, bi people who are not trans will never understand. So we don't have a choice. And I think in many ways, we're sort of dependent upon, in a horizontal way, the people that are around us. I'm not thinking so much about the so-called general public, the non-trans, non-LGBT public. I'm thinking about the fact that we still have, and I don't want to just say it's the burden of trans and gender nonconforming individuals, but we as a collective, we want to call it LGBTIQ, and I'd like to add more letters because I think it's really important, we have to do some horizontal education, all right? It's not happening yet, and what happens is because the folks that are running the initiatives are from long-standing organizations that have already existed and are largely LGBT but not trans-identified or gender nonconforming. The fact is that the burdens placed on trans people who come into these spaces to do the educating. And a lot of times we get really tired and we give up and we go away. Some people are nodding their heads, they know what I'm talking about, right? We can't do this anymore, okay? We cannot be expected to do this. It's like anti-racism training, okay? It's like white people need to do their work. And non-trans people need to do their work. Not just saying the door's open, it's saying the space is fundamentally changed and you are part of it. And the policies and practices and group norms and ways of speaking about bodies and identities and ways of being in the world are all about you as much as they are about us. So there's no you, us, and them anymore, okay? So that's what I want to leave it with, is that I think in Philadelphia we still have this challenge, particularly with now elder issues, of doing this horizontal education and creating spaces from the ground up that are already about affirming trans folks in terms of how we relate to each other, in terms of how we create these spaces.
And one of the primary goals behind putting this report together is to really make sure that the Aging Network is prepared for LGBT older adults. And really, this is going to be a problem, and I say problem in quotes, but it's a problem that's only going to be growing as more people, get up to that age. And one thing we tried to do in putting this report together, to piggyback on what Ben is saying a little bit, is to make sure we had a wide variety of viewpoints as part of the committee that put the report together. So it wasn't just people who are activists or just people who work for LGBT organizations, but a wide variety of people who have a voice and a say in what came out of this report. And it all made me think of two quotes that I heard yesterday from people in the audience at other sessions I went to. One was, "We don't know where we want to be, but we know how we want to be." The idea being that we really want to make sure that we're treated the same or similarly to everybody else in a way that identifies our unique needs. And in the audience in one of the other sessions I went to, there was someone who said he was 20 years old, and people asked why he was there. And he said, "I don't see any older role models for being trans." And he said that coming to these sessions really gave him some hope. And to me, I think that gets to another one of the goals of what this report is about, is to show that people are actually thinking about this, and that people are cognizant that there's these issues out there that we're trying to take on and trying to prepare for. So I don't have too much more to say from our angle. I mean, I feel like Harper Jean talked a lot about the substance of what came out of this report, and the other panelists talked about a lot of the other issues that we tried to address. But getting back to the AG network, I mean, I think another thing that Ben said is something that really resonates with me, which is that T folks don't really have the quote-unquote option to go back into the closet. And not that that's a good option in any way, but it's certainly a phenomenon that we hear about in the LGB community. And we are doing our best effort, and we're relying on reports like this to try to make sure that the aging network is much more culturally competent. And that's one of the functions of the National Resource Center on LGBT aging, and Hillary Meyer from the National Resource Center is here to answer any questions as well. But we do realize that when people are in these institutional settings, they're more vulnerable than they really have ever been. And as many of us know, it's already hard enough to be sick or to need care in any sort of way if you don't have these other issues layered on top of it. And you can just imagine how difficult it would be to be in an environment where you don't have that autonomy, and you lose that control, you lose the privacy. And what we want to do, and what the goal of this report is to do, is to try to make sure that sort of environment is as culturally competent and as receptive and open and welcoming as possible. So I don't know if folks in the audience have any questions, or people who participated have anything to add.
Have you all done a handshake with the VA?
We have been working with the VA, and I know Harper has been very involved.
Yeah, I'll just say, as some folks may know, the VA put out a directive on providing care for trans and now nationally, right, for providing care to trans folks and folks with intersex conditions. They actually have an internal working group. They have a great chief of psychiatry at one of their medical centers in Tennessee who's been leading up this effort to roll out training and roll out frequently asked questions and other things to help implement this directive within the VA, because we have so many older trans folks who are veterans. And it's been a great relationship, although I gotta say, like, a lot of stuff that's been going on within the VA has been driven internally as much as externally from advocates, because there are just people within the department that have a real interest in, and some of them have some real knowledge about this, which has been very exciting.
And we've reached out to them to make sure that they're aware of the National Resource Center and the materials it can provide, and also the trainings it can provide. One thing we do want to flag is that this report is available online, so we encourage you to share it in your social networks and everywhere else. In addition, there are some executive summaries at the back of the room, so feel free to take more than one. We have plenty. We also encourage you to, again, tweet and Facebook and let people know about this that way.
So thanks, everybody, for your interest in this. We're really excited about it. You will be too.
Can I acknowledge you, Pat, who's like the first trans guy I met in like 1995 I'm sorry, I don't know if you want to out yourself in terms of age, but like you were already an elder when I met you. You don't want to tell anybody? I mean, you've been like transitioning for like 4 years. I mean, or you did 4 years
I
ago.
started transitioning in 1971.
Okay, this is really important, people. Like, and Jude, you're a really important resource. I think I'm doing a little networking right now to like connect up with these initiatives. I have an article that you wrote that I'm hoping some of these initiatives might want to publish from a trans person's perspective, who also has a provider-based knowledge as well. So I just want to draw attention to that and say that I think we need to continue to outreach and network and really draw upon our resources that Jude shows up, but there's people from his generation that are either gone or just we can't find them.
Is there a source that article can be found on online?
Well, I didn't write that.
Oh, I thought you wrote it.
No, they just asked me to do a
You put your picture
I'd
on
be
it?
the lead-in picture because I'm an old person. Okay.
But do you like the article? Like the content you feel is...
They interviewed me for the article.
Oh, you're interviewed, great.
And it's so long because it's so hard to travel. I'm reachable at judepatton@aol.com.
I'd just like to see more voices and more analyses from trans folks themselves, particularly elders in the press. And when you handed me this yesterday, I was going to pass it on.
Okay, thank you. Thanks a lot. The people here the reason I'm here is because Hawk has befriended me over the years. We've known each other maybe 10, 12 years. And the reason I stayed out rather than in the old days, you were told you were not a success unless you went stealth and never looked back. But I had great support, including from the physician who did my surgery, and began to be included not only as a provider but an advocate through the years, and just personal things that kept me more recently from being more involved.
Thanks.
I'm Chris Bartlett from the William Wayne Community Center, and I really appreciate both the report and the hard work that went into it. And I just wanted to say, in terms of how we begin to talk about this work, it would be great to hear some thoughts on ways of framing the conversation. That when I speak about elder work in general, I talk about the generation of LGBT people who created LGBT liberation, created our organizations, created our communities, and that this is part of our gift back to these people who created LGBT liberation. So that's one thing I say. I don't know if that resonates with people. But the other piece that I feel is really important is the intergenerational connection between youth, adults, elders, and even ancestors, which tend to get left out of the picture. But remembering the people who have died and being able to celebrate trans ancestors, but also looking at how do we connect elders so it's not viewed. But I think that youth work for so many years was like youth work. We do youth work, creating safe space for youth, and sometimes safety was like, don't let them near the elders. Like, how do we begin to, bridge that fear and look at youth, adult, elder interconnection so that, the youth who was in that workshop yesterday can have connections with trans elders who can, and I've had trans elders in this room and other places who made such a difference in my life. I have such gratitude. And yet I don't feel like we have models for that intergenerational conversation. And I'm a little afraid that elder will be sort of reified as this thing that's separate from the other generations. And how do we do that?
Well, I think, Chris, to speak to that a moment, is that Jude and I and Alan Libman for 2 or 3 years at True Spirit and other conferences did an intergenerational workshop and conversation that was pretty groundbreaking at the time. And we no longer do that, but I think that dialogue is really necessary. And I think across the generations, it's really, really fruitful. I'll share a brief story from my practice is that I was seeing a young, just turned 5-year-old boy who identified as a boy and was going to start kindergarten. We were going to transition him into kindergarten. And he came in with his dad. His mom was out in the waiting room with the other children. And he was sort of snuzzled up against his dad, who's this big, tall guy, and kind of, a little frightened to begin talking with me. And I don't generally disclose to kids that I'm trans unless it's necessary therapeutically. And his dad leaned down and looked at him and he said, he's like you. And this kid's eyes just lit up. And I leaned into across the space and I said, you're going to get old too. You have a future. And it changed the kid's life. And I think what you're saying, Ben, is so important, is that what that young man said in the workshop yesterday about looking at his future and knowing that there were other people out there is so important. I mean, that's what we offer. That's just wandering around the conference. I mean, you know, a lot of people say, who's the old guy? You know, well, you know, sort of the old guy's why you're here, you know, because people broke ground. And I think that is important. And I think this report, I think what you said, Ben, about this report is younger folks, in some sense, a thank you or recognition of my sense of how far we've come. I mean, that this is coming out. It's just so wonderful.
We're doing an on-the-spot interview.
On the spot.
Yeah.
Well, come on in.
I know people are going to be very curious to see
So I'm a
who you
member of
are.
the committee that put together this report for transgender aging policy at the federal level, and I'm a trans guy and a guy in private practice in Albany, New York area, and about to be ordained an interfaith minister, and I've been working in activism in this community for close to 20 years now.
Well, I think your story was one of the most touching and fabulous stories, to tell you the truth, I've ever heard.
Well, thank
It
you.
was just wonderful that for, you know,
Thank you.
for a kid to see an older man with a cane.
Two of them, actually.
Two of them. Okay, thank you very much.
Even though it's a step, and it's what, it's like, wow.
I think the dynamics are a little different, Chris. I don't think it's about, keep the youth away from the older people. You know, I don't think that's the weird dynamic in our community. And I'm talking about trans folks now. What we have is just, like I said, I'm acknowledging you because people in his generation, Sandy Stone, who's a long time, like, you know, well-known trans activist theorist, says, we were programmed to disappear. The medical community programmed us to disappear. They literally add lives. Your transition includes disappearing. Okay? My generation, which was the next, we were the first to get together. 1995, first trans F2M trans masculine conference in the world. 1995, San Francisco. Okay? In a room with 200 other people like me. I'd only seen one other person like me before that in this city, and one on television. Like, I had nobody, no imagination. I didn't know even people like me existed as I was growing up. So what dynamic we have, unfortunately, I think, is starting to develop a little bit of a cult of youth and coolness. And people like Hawk and I remember the moment at a True Spirit conference when I was on an elevator, and for the first time, people got on who were younger than me and looked right through me because they thought I was a participant. I mean, they didn't think I was a participant of the conference. They thought I was just staying at the hotel at the same time. And I'm like, wow, I'm no longer like seen in these worlds. So I think that that's happening to us. We're no longer being seen in these worlds. And taking the initiative and talking to younger folks. And I'm saying, A, there's a history here you don't know about. You didn't invent this. This happened in 96, this happened in 90, this happened in 80. You know, like, they don't even know. Genderqueer was doing in 1980s. There wasn't even a word for it. I mean, I'm just saying, like, there's a lack of memory, there's a lack of history, there's a definite shift in terms of the tone of this conference towards younger and younger, and also transmasculine. I'm going to admit that. Like, it didn't end up that way. And people need to know that history too. Trans guys were not part of trans social world. It was largely dominated by like white middle class trans women until the point at which some of us started crashing the gates and saying we're included here. And then we would be huddled in the corner. There would be 200 trans women at a conference, and 5 of us huddled in the corner, had nothing in common with each other, and the fact that we were like completely overwhelmed until we had our first conference, until things got going. And now I think it's just been skewed the other way, and we need to work on that too. But I am of a generation where trans women and trans men actually had to talk to each other, wanted to talk to each other, and work together. And I still believe in that. I believe that we need to. I don't believe that we need to keep separating out. But I also believe we need to understand our differences, and we need to advocate for each other when we're being like marginalized. You need to stop. administration.
No, I mean, I think that's a great, as good as a note as any to add to wrap up on.
Yes.
So, thanks, everybody, please be in touch, let us know if you think of a report. Thank you.